This segment of Bridge Street is sponsored by St. Joseph's Health Cardiovascular Institute.
Well, there are so many numbers we women know by heart, right? Our kids' age, birthdays, anniversaries, but there are some numbers that we probably don't know and we should.
That's right. There are 5 personal health numbers women need to know. And joining us this morning with what they are, our owner of the Heart Health Academy, Andrea Atcheson, and cardiologist Dr. Nelly Kazzaz from St. Joseph's Cardiology Associates. Good morning.
Good morning. How are you, ladies?
Good. How are you?
Thank you for having us.
Yes. Thank you. Well, we know our PIN number. We know our garage code. We know everything. We know all those numbers, but there are 5 numbers that we should know about for our personal health. And let me tell you, I don't even know what they are. So I'm glad you're here this morning to tell us, Dr. Kazzaz. What are the numbers not the numbers, but what are the I guess the numbers that we need to know.
So as you said, we know a lot of numbers as women, and the most critical numbers that we should all know for our heart health are our blood pressure, blood sugar, our waist circumference, or what some people talk about BMI, basic mass index, based on our height and weight, and most importantly our cholesterol and blood sugars. Primary prevention is the most cost-effective type of prevention, and it's aimed on the whole population. If we know what our risk of heart disease and we can prevent it before it occurs, that's the goal, and that's what I do every day. Is I want to see my patients before they actual patients. So I do encourage people to go to their primary care physician and ask to know all these numbers. Most of them are very simple testing in the office or blood work. I do not concentrate on the target numbers as much because they vary depending on our age, depending on our family history, depending on our status. We do recommend lifestyle modification first, and of course some people will have to have medications to get to their targets. And most importantly to remember is that 80% of heart disease is preventable. So if we do the right thing, we lose weight, we avoid eating unhealthy food, we exercise, we stop smoking, we can prevent up to 80% of heart disease, which continue to be the #1 killer of women in the United States and the world. The 2 things that we cannot change is that we will age, and if we have a family history of heart disease, then we are at a higher risk of it. But everything else can be modifiable and can be changed with knowing our numbers.
Let's talk about, Andrea, even like the signs and symptoms though for women, because that's just as important. And there are some women that don't know these numbers, but know something's going on.
Right, and here's the thing, women present a lot differently than men. There are some things that are similar. You might get that chest pain, but for a woman that is sitting there, they might feel something like an indigestion or a heartburn or maybe like a squeezing sensation. It's not always like in the movies when the guy says, oh, I'm having a heart attack and an elephant sitting on my chest. They might have back pain or just fatigue mixed in with nausea. And a lot of us women, as we know, we're so busy with our kids, for example, with life, with work, and we gaff it off and say, oh, it's just something I ate last night for dinner. So really being aware of these symptoms, especially when they're in combination with each other, don't ignore them. At least you could just make a phone call to your primary care physician, triage nurse, and say, hey, do you think I need to get in? Because I'm not really sure what's going on, but something is not right. Something feels different than it usually does.
Well, and if something does feel different, that's right. You can, reach out to those who may be able to help you. And Andrea Atcheson is a physician's assistant, wellness coach, and chef. And if you would like her to help you, you can visit thehearthealthacademy.com.